Does it cost more to manufacture the beam or something?
Well, right now the facility costs a lot. Probably hospitals and people who buy the facility want to get paid for their facility.
Okay.
So the treatment can be $50,000 to $100,000.
Wow.
So even if people are paying 20% copay, the copay can be more than our whole treatment. So I believe from an efficacy point of view, we're better. I believe from a cost point of view, we're better.
Yeah.
What drives people to get proton? Well, there's this whole idea if you have something new, it's better than something old.
Right.
And there's a study that's out at New England Journal that says that half the new technology is worse than the old technology,
wow.
which we'll talk about in a little bit.
All right. In the meantime, I want to remind the listeners that they can call 800-321-0710 with any questions for the doctor.
Okay, so we're going to go to a word from our fantastic sponsors, and then we'll be back to talk more about cancer news. For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you, Body Radiosurgery Cancer Treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
News Talk Radio 710
WOR.
For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, we hit the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, good morning. Good morning, Dayush.
Good morning.
So there's more cancer news about cervix cancer today. Latest update, there are women with cervix cancer. Usually cervix cancer is detected by pap smear. And if you get pap smear, and I urge you to get pap smear if you're a woman, you can find abnormalities. And most cervix cancers actually can be avoided or detected early and cured. Unfortunately, there are some women who have metastatic cervix cancer, and there's actually some news showing better treatment. So there's a new study that was done combining Avastin, which is a biologic agent, with chemotherapy. And there was a phase 3 study. So earlier we talked about what phase 3 means, which means there's two arms of the study, either the traditional treatment or traditional treatment plus Avastin. And the arm that got the new treatment, Avastin plus cisplatin plus Taxol, was shown to be beneficial. How so? So there were 452 patients with recurrent or metastatic cervix cancer, and they were randomly allocated to one of the two arms, the Avastin plus cisplatin plus Taxol, or cisplatin and Taxol alone. They were given every 21-day treatments until complete response or toxicity or the cancer progressed. So it's pretty usual phase 3 study, and there was an improvement in overall survival.
By how much?
Okay, so women who had Taxol had an improved survival. The median follow-up was 20.8 months, and overall survival, if you had Avastin plus the chemo, was 17 months, and with chemo, it was 13.3 months. So you're talking about 3.7 months improved survival.
Wow. And you think that's significant, Doctor?
Well, let's say it's a step in the right direction.
Yeah.
So it's not what a woman wants. A woman with cancer wants to be cured.
Right.
But at least it tells you that there is a chance of getting a better result than the usual treatment. And for someone with cervix cancer, you may want to know that before you get put on a chemotherapy. And you may want to know about other choices that are out there, even some non-chemotherapy choices. We're treating right now a young woman with recurrent metastatic cervix cancer with radiosurgery.
Oh.
She had surgery. She had special surgery at a special cancer hospital to try to save her uterus because she wanted to save her fertility.
Yeah.
And within a few months after that special surgery, the cancer relapsed.
Oh.
She then had standard chemo and standard radiation, which radiated a lot of her pelvis and her abdomen.
Yeah.
And then the cancer came back a few months after that.
Again.
And she came to us. We treated her, and actually the areas that we treated shrank. All the cancer shrank. So the last scans we saw on her, the radiosurgery worked, and we're hopeful that she makes a full recovery.
Oh, that'd be great.
So hopefully she's listening to us and wishing her well in her course of cervix cancer and recovery, in regards to her parents also. We had several other people who called during the week and who actually came in. One woman called me Friday night, and she was upset we didn't talk about optic nerve meningiomas.
Okay, optic nerve meningioma. That's in the eyeball.
Okay, so optic nerve means what to you?
It says is the nerve that connects the eye to the brain.
Right, exactly.
Yeah.
So the eyes are actually part of the brain. They're directly connected to the brain.
Right.
And they're connected by the optic nerve. And the optic nerve carries vision from the eye to the brain. Do you know what meningiomas are?
They're benign cancers. Tumors.
Benign tumors.
Right.
Well, they're usually benign. There's actually 3 forms of meningiomas. Meningiomas are tumors that are on the coverings of the brain, usually.
Okay.
So the meninges
Meninges.
is a name for the covering of the brain, and meningioma is usually a benign tumor in the head of the coverings of the brain. The problem is that benign tumors in the brain are not like benign tumors elsewhere because the brain is very delicate and it's locked in the skull.
Right. If you press up against it, you can
cause harm. If you press up against the brain, the skull is not moving anywhere, right? So the tumor grows, and it puts pressure on the brain, and people can have neurologic damage.
Yeah.
And you can imagine the optic nerve, if tumor grows, people can lose their vision.
Yeah, sure.
And we've seen people come to us. So the main treatments are surgery. And this woman's been to most of the major doctors in the New York area for surgery. She's declined surgery. I think she's realized the potential risks.
Oh, it's very dangerous, no?
And it's dangerous if the tumor's up against the optic nerve, so any pressure on the nerve by the surgery, and she may lose vision.
So no matter how great the surgeon is and how delicate his fingers are, he could still make her lose her vision.
Well, it's always that risk, and it has nothing to do with the surgeon. It has to do with the fact where the tumor is and what's adjacent.
Exactly.
I gave her our data. We've treated hundreds of meningiomas over many years. We were the first in New York to do fractionated brain radiosurgery for benign and malignant tumors, and our success rate is 97%. Success means that we can stop or shrink or make that tumor go away.
That's huge for a number of, when you're talking about cancer treatment in any way, isn't it?
Right. So 97% is our data. We treat patients who want to be treated, and then we follow them up with MRIs. So I gave her the data. She's getting a new study in September. She gets one every year, and then she's going to come in and we're going to talk about the results. I told her to get the first study compared to the last study, because sometimes radiologists just compare the new study to the most recent study, which is the shortest interval of time, but it doesn't really reflect what's going on in her body. She's been getting scans for many years, and I like to get that information, but I also like to get the information how much it's changed over the years. So it gives the patient an idea, how much is my tumor really growing? Because maybe they say, a millimeter is not very much, but if it's a millimeter a year and it's been 10 years, that's a centimeter, and you're talking about a lot more change.
Yeah.
So anyway, it seemed very appealing to have a treatment that had no cutting and no bleeding and no anesthesia, and you come in and get a treatment and go out to lunch or go out shopping or go back to your family and loved ones.
Yeah.
So I think that she'll probably be coming in, and again, if she's listening, at least you know we're thinking of you, and I promised that I'd be thinking of you on our radio show today.
Yeah, and if you feel like calling, the number's 800-321-0710 for any questions or concerns.
Yeah, we're here live today. We got up pretty early to be here on the show and hopefully provide information that's interesting to you. We had another patient on Friday that I'd like to talk about, and this is a gentleman who's very distinguished, had esophageal cancer.
Okay.
So he's a big businessman. He was going on a big trip overseas about 3 or 4 years ago.
Okay.
And he bit on an apple, and the apple got stuck in his throat and was nearly choking to death.
Needed the Heimlich maneuver.
Yeah, that's what it's about. And he was able to get the apple out.
Okay.
And then shortly thereafter had a piece of sushi, and the same thing happened.
Oh.
And at that time, he went to the doctor.
It's weird, huh?
And usually people get stuck on more solid food like steak or something like that.
Right. Not apple and sushi.
Right.
Yeah.
So maybe he didn't chew. Maybe he's in a hurry or something.
Yeah.
So anyway, so he had an esophagram, which is an X-ray to look at the esophagus.
Okay.
And that was normal. So he was, let's say, falsely reassured. And then
that's the worst, right?
I don't know. There's a lot of things that are bad. And then he had endoscopy, so the doctors put a scope inside the mouth, down the throat.
With a camera on the tip, right?
Exactly.
Yeah.
And they were able to see the cancer. So it turned out to be an esophageal cancer.
Why did that not come up on the X-ray, Doc?
Maybe how the X-ray has someone swallowing barium, and it has to be caught at the right moment, or maybe the tumor wasn't so big as to obstruct the barium.
Oh, the timing was off or something.
Probably. I don't know. I didn't see those documents. Okay. And he then had radical surgery, so they removed his esophagus.
Oh, my goodness.
And he's had side effects from that. He can't go to bed within 3 hours of eating, or the food comes up, because nothing to stop the food from going up the opposite way.
Yeah.
But nevertheless, he's done well, and he's continued his work. As I say, he's a very distinguished businessman. He's 80 years old. And he had chemoradiation afterwards. And 18 months ago, he had a recurrence of the cancer.
Oh, I hope not in the same spot.
Well, I wish he didn't have a recurrence anywhere.
Yeah.
But his recurrence was in a lymph node in his abdomen by the aorta. So the aorta is the main blood vessel from the heart outside the heart.
What a tragic story.
And it's sad. And he gave up on normal medicine. And he went on a product, and the product was called CanCell. And he took it every 6 hours for a year and a half.
What is that? What's cancer?
Well, you can look it up online. It seems like the FDA in 1978 advised people not to take it, that there was no efficacy of taking it.
Oh.
But a lot of people want an easy solution or believe in miracles.
Right.
And this is an agent that had no proven benefit.
Huh.
So he's an intelligent man. He took it, and for 18 months he got no more tests.
Okay. It's probably not a good idea.
And, well, you'd think if you're going to take something, okay, at least get a follow-up and see what's going on. Because
Yeah.
if the cancer is growing, it's telling you the treatment's not working.
Yeah.
So it took